This is the axilla or armpit. It's a pyramidal space filled with vessels, nerves, lymph nodes, and fat. It has an apex, a base, an anterior wall, a posterior wall, a medial wall, and a lateral wall. This is the anterior wall. It's formed by the pectoralis major and pectoralis minor muscles and the clavipectoral fascia. The lower border of this wall is called the anterior fold of the axilla. This is the posterior wall. It's formed by the subscapularis, latissimus dorsi, and teres major muscles. Notice that the latissimus dorsi has a triple relation to the teres major. It lies first posterior, then below, then anterior to the teres major at their insertions into the humerus. Notice also the tendinous nature of this part of the latissimus dorsi as compared to the fleshy nature of the teres major muscle. The teres major and the latissimus dorsi together form the posterior fold of the axilla. This fold reaches to a lower level than the anterior fold. The medial wall of the axilla is formed by the upper 5 digitations of the serratus anterior muscle, which arise from the upper ribs. This is the long thoracic nerve running vertically on the surface of the muscle nearly in the spine. The serratus anterior covers the related intercostal spaces with their intercostal muscles. The lateral wall is narrower than the medial wall. It's formed by the upper part of the shaft of the humerus with the related coracobrachialis and short head of biceps muscles. The base of the axilla is directed downwards and is formed by the axillary fascia. The axilla is now open to show its main contents. Notice the vessels and nerves as they pass from the root of the neck to the axilla through its apex. The apex of the axilla is bounded by the clavicle anteriorly, the first rib medially and the upper border of the scapula posteriorly. This is the first part of the axillary artery. It is the continuation of the subclavian artery. It's related medially to the axillary vein, which is directly related to the apical lymph nodes. The medial cord of the brachial plexus is posterior to the artery. However, the lateral and posterior cords are above and lateral to the artery. All these structures are covered by the clavipectoral fascia and the clavicular head of the pectoralis major muscle. The first part of the axillary artery gives off a slender branch to the upper part of the front of the chest called the superior thoracic artery. This is the second part of the axillary artery. It lies deep to the pectoralis minor muscle. It's related to the cords of the brachial plexus according to their names. That's to say, the medial cord is medial, the lateral cord is lateral, and the posterior cord is posterior. The artery and the surrounding nerves lie on the subscapularis muscle, just medial to the coracoid process. The second part of the axillary artery gives off two branches. These are the thoracoacromial artery, which uses the clavipectoral fascia just above the pectoralis minor muscle, and the lateral thoracic artery, which runs downwards on the side of the chest along the lower border of the pectoralis minor muscle and is one of the main arteries supplying the breast. The lateral thoracic artery is accompanied by the lateral thoracic vein. This is the third part of the axillary artery. It is surrounded by the branches of the cords of the brachial plexus as follows. Laterally, the artery is related to the musculocutaneous nerve and the lateral root of the median nerve. These nerves arise from the lateral cord. Medially, the artery is related to the axillary vein, from which it is separated by the ulnar nerve and the medial cutaneous nerve of the forearm. The ulnar nerve is deeper to the medial cutaneous nerve of the forearm, and both nerves are derived from the medial cord. Posteriorly, the artery is related to the axillary and radial nerves. which are branches of the posterior cord. The third part of the axillary artery gives off three branches: the subscapular, the posterior circumflex humeral, and the anterior circumflex humeral. In this specimen, the three arteries arise about the same level. This is the stump of the anterior circumflex humeral artery. Now, the branches of the cords of the brachial plexus are to be traced in the axilla and arm one by one. This is the musculocutaneous nerve. It arises from the lateral cord and pierces the coracobrachialis muscle, which it supplies before piercing it. It then continues between the biceps and the brachialis, supplying both muscles. It emerges at the lower end of the lateral border of the biceps muscle, where it becomes the lateral cutaneous nerve of the forearm, which runs along the lateral aspect of the forearm down to the ball of the thumb. This is the median nerve. It arises by two roots: the lateral root from the lateral cord and the medial root from the medial cord. The medial nerve descends lateral to the upper part of the brachial artery, then crosses in front of the artery to lie medially lower down. You can easily identify the lateral and medial cords of the brachial plexus by following the medial nerve upwards. Its lateral root is a guide to the lateral cord, and its medial root is a guide to the medial cord. This is the medial cutaneous nerve of the forearm. It arises from the medial cord, superficial to the ulnar nerve, and descends towards the medial epicondyle and continues on the medial side of the forearm. This is the ulnar nerve. It arises from the medial cord between the axillary artery and vein. It passes downwards and medially to enter the posterior compartment of the arm, to lie behind the medial epicondyle. It's accompanied by the superior and inferior ulnar collateral arteries, which arise from the brachial artery. This is the superior ulnar collateral artery. This is the brachial artery. It's the continuation of the axillary artery and ends in the cubital fossa opposite the neck of the radius by dividing into the radial and ulnar arteries. The median nerve lies medial to the artery down to the cubital fossa. Now we shall display the posterior cord and its branches, which are the upper and lower subscapular, the thoracodorsal, the axillary, and the radial nerves. This is the upper subscapular nerve. It enters the upper part of the subscapularis muscle. This is the lower subscapular nerve. It enters the lower part of the subscapularis and supplies also the teres major muscle. This is the thoracodorsal nerve, or the nerve to the latissimus dorsi. It descends along with the continuation of the subscapular artery to enter the latissimus dorsi. This is the subscapular artery, which is a branch of the third part of the axillary artery. This is the axillary nerve. It enters the quadrangular space accompanied by the posterior circumflex humeral artery. Both structures wind round the surgical neck of the humerus to end in the deep surface of the deltoid muscle. This is the radial nerve. It is the thickest and the longest of all branches. It descends in front of the subscapularis muscle and the tendons of the latissimus dorsi and teres major muscles to enter the spiral groove. In the spiral groove, it's accompanied by the profunda brachii artery, which is a branch of the uppermost part of the brachial artery. Note that the radial nerve gives off two branches in the axilla. One muscular branch to the long head of the triceps muscle, and one cutaneous branch, which is the posterior cutaneous nerve of the arm.